All right, right now I'm so excited because I'm here with Dr. Carlson, who is an orthopedic spine surgeon here at OSC. Dr. Carlson,
hi.
I've heard so many wonderful things about you.
Well,
I had the pleasure of speaking to one of your patients, Heather, who had a spinal fusion. And just in general, what exactly do you do here? What exactly is an orthopedic spine surgeon?
So as a spine surgeon, most of what I do is takes care of the neck, middle back, and lower back. So look at all the bones, all the discs, muscles and tendons, those sorts of things. The biggest things we do are surgical options, so things related to nerve problems. Pinching the nerve roots, disc herniations, the bones are slipping, those sorts of things where we need something surgical to fix that problem. What we do here at a specialty center like this, so a lot of our surgeries is done through what we call minimally invasive approaches, so smaller incisions, less injury to the body itself, because we really just want to fix the problem and then get back out. So a lot of our surgeries done are outpatient surgeries, so even large lumbar spinal fusion surgeries, neck surgeries, lower back fusions, where we're putting in screws and rods, which used to be, 20 years ago when I graduated, that used to be we'd keep you in the hospital for 3 or 4 days. Now the big surgeries like that, they can go home the same day. And the reason for that is we're doing less trauma to the body, doing less invasive approaches there, not injuring the muscles as much, fixing the disc problem, fixing the nerve problem, and holding the bones so that the patients can be up and walking that same day.
And how soon until somebody starts physical therapy, and what is recommended for somebody after a procedure like that?
So the first 2 weeks we'll get the physical therapist and nurse come to the house, make sure you're safe, make sure you're getting up, make sure you're moving, make sure you're doing the things you're supposed to be doing at home, getting around, make sure the home environment is safe, and having the nurse there checking the wound, that kind of thing.
Right now I'm at OSC with orthopedic surgeon Dr. Haynes. I'm really excited because you are a pro. You have been a surgeon for a very long time. Could you tell us a little bit about that?
Yeah, so I've been an orthopedic surgeon here for about 30 years. All right, it's quite a long time. And I do all sorts of different things, including hip and knee replacement and a lot of sports injuries as well. I just don't work on spine surgery.
When somebody comes in for surgery, what can they expect? What exactly are you doing? Because when you hear total knee replacement, it is a bit scary, right?
Yeah.
And so what exactly is happening during that procedure?
All right, so typically when you say total knee, you're replacing all parts of the knee. There are partial replacements of knees where you just replace segments, but a total knee is the predominance of what we do.
Okay.
So they come in that day, they go home the same day. 95% do not stay in the hospital anymore. You go ahead and take out all the arthritis in the knee and replace it with an artificial metal and plastic knee.
Okay. What is the best outcome that somebody could experience after a knee replacement specifically?
Well, eventually I want people to get back to what they normally do. If they like skiing, if they like running, if they like riding a bike, weight training, I want them to get back to doing all those things. If I want them to crawl before they walk, walk before they run.
We're here at OSC and I'm really excited because I'm with orthopedic surgeon Dr. Stewart. You are a surgeon here. Can you tell us a little bit about that and what you specialize in?
So I can do all of orthopedics, but about 90% of my practice is from the knee down. I do venture off some other places if patients have known me for a while, but most of my practice is orthopedic foot and ankle.
Okay. So what exactly is it about OSC that makes all the patients feel so good, confident, and comfortable?
I think you just have to deal with most people. We're not going to talk to them about surgery till they've failed everything else. So no one comes to us for a knee replacement, ankle replacement with a pain score of 0.
Right.
So most of them are walking around pretty miserable to begin with. And then you say, well, you're going to go through pain for a few days, a few weeks, you know, and then it's going to be better.
I know they're going to have some things that they can do, but are there some limitations that you see?
Getting your hip replacement and playing football, not a good plan.
Okay.
So running on a total ankle, not a good plan.
Right.
So again, you're talking about a 6 to 8 millimeter piece of plastic between 2 pieces of metal that you're trying to make last the rest of your life. So the American Academy of Orthopedic Surgeons doesn't recommend running even for total knees. You can call and ask questions, and certainly come in and call and make an appointment, and we'll be happy to take care of you.
Yes, thank you so much, Dr. Stewart, for getting people back on their feet again, no pun intended. So thank you so much.